7 dog breeds that tend to develop joint issues. According to a vet expert vet, Dr. Mark lists the breeds prone to joint disease, along with some tips to lessen the severity. Among dog breed populations that have been surveyed, it's been found that about a third of the dogs have joint diseases. You know that since they are genetic, the issues can eventually be eliminated. But in the meantime, these are some of the dogs that are likely to suffer from these diseases: Labrador Retriever, Golden Retriever, German Shepherd Dog Rottweiler, Great Dane Bernese, Mountain Dog St. Bernard 1, Labrador Retriever. There are several other joint problems that labs suffer from, but they're probably the most affected by hip dysplasia, and it's severe enough that it leads to arthritis. This is a disease where the ball of one of the leg bones dorsum fit correctly into the socket of the hip. It can be caused by a very shallow socket on the hip, a poorly formed ball that cannot fit into the socket, and sometimes it's so poorly connected that the ball isn't even inside the socket. There are many treatments, but generally dogs that suffer from this disease are in pain from a young age. Some dogs will need surgery, but others can get by with massage, hydrotherapy, supplements, pain medications, and weight control. Try a whole food diet. One of the things that's often suggested is to keep your dog from becoming obese. That's much more difficult with labs than some other dogs since they like to eat. And switching to another commercial food isn't the answer. Studies have shown that many fail when switched to another commercial diet. Commercial dry dog foods sold for weight loss just substitute the cheap carbs the dog has been eating with indigestible fiber. It doesn't taste good, and although the corporations add flavor and chancers, most dogs do not like it. The dog begs all the time, so the owner ends up giving something else, often a high-calorie treat like a chunk of cheese. If you want a better alternative, you can try a meat-based whole food. Whole food diets are more satisfying, so even if a dog is eating fewer calories, he or she will be more satiated. Here's a recipe for whole food. But if you don't have time to make the food, there are several alternatives you can try. 2. Golden Retriever. Hip and elbow dysplasia are also common problems with these dogs, and if you get a golden puppy, you should make yourself familiar with the signs, as they can show up as early as 4 months of age. Goldens are also prone to patellar luxation. While that's not a primary disease of the joint, it does affect the knee joint. The kneecap is out of its normal groove, and the dog may limp and eventually develop arthritis. 3. German Shepherd hip dysplasia is also an important joint disease in German Shepherds, though they can also suffer from elbow dysplasia. Treatment methods are the same as with all breeds, with hip dysplasia: hydrotherapy, massage, supplements, pain medications, and eventually surgery. And prevention is as simple as stopping the breeding of dogs predisposed to these diseases. Despite x-rays of breeding dogs' hips being suggested for many years, this is still a big problem among this dog breed. 4. Rottweiler. These dogs are seen for hip dysplasia, osteochondrosis, osteochondritis, and even luxating patellas. Rottweilers are also predisposed to a ruptured cruciate ligament, which leads to joint problems with the knee. Their joint problems often show up secondary to obesity. So the same weight suggestions I made for the Labrador apply to the Rottweiler. 5. Great Dane. These dogs are subject to several problems because they re-large and have long bones covered in little muscle. Besides hip dysplasia, some Great Danes also suffer from a developmental disease called hypertrophic osteodystrophy. As they get older, they often suffer from a type of bone cancer that can affect the joints. 6. Bernese Mountain Dog. Although Bernese Mountain Dogs also suffer from hip dysplasia and osteochondritis dissecans, their most serious problem is usually elbow dysplasia. Some dogs will respond to pain medications and limited exercise, but others will need surgery. Even St. Bernard. The joint issues with St. Bernards are similar to the others, as hip dysplasia is the main problem. Some dogs also have elbow dysplasia and OCD. Tips to help dog breeds with joint problems. If you do adopt one of the dog breeds prone to joint disease, there are things you can do to reduce the chances of having problems. In most cases, this is a genetic disease, and you cannot prevent it. However, you can certainly make it less severe if it does happen. Prevent obesity. Limiting calories is not enough, but a whole food, meat-based diet will provide more satiety and keep your dog from gaining weight. Give joint supplements. Before your dog develops arthritis, anecdotal reports suggest glucosamine and chondroitin may be protective. One natural source of glucosamine is chicken feed, but supplements are also available at pet stores or Amazon. Offer soft bedding. Dogs with joint diseases are in more pain than other breeds and develop fewer problems on a soft bed. If you have a giant dog, you can use a couch or purchase an elevated dog bed. Exercise them. This needs to be daily, both to keep the dog in shape and not allow him or her to become obese. The exercise doesn't need to be excessive, just normal walking. But if you have a giant dog, they are going to need longer walks than a small or medium-sized pet. Swimming is a great option for any dog prone to developing arthritis.